Hello, today we will be doing a basic cranial nerve examination. So I will be doing cranial nerves 1 through 4 as well as 6.
And then I'm going to be doing cranial nerves number 5 and 7 through 12.
Okay, so we're going to start off with cranial nerve number 1. This is the olfactory. So I'm going to be testing your sense of smell.
Okay.
So I'm going to wave my essential oil. Can you smell it?
Yeah.
Mm-hmm. Okay, now I need you to block one of your nostrils so we can smell them separately. Okay. Yeah. And then the next one. Mm-hmm. Okay. Yeah. Did you have equal smell in both nostrils?
Yes.
Okay, cool. So that concludes number 1. Next, I will be checking your visual.
Okay.
So this will be going over the optic.
Okay.
So basically what you're going to do is just look forward.
Okay.
I'm going to slowly bring the pen into your view and let me know when you see it. Okay.
Yes. Yes. Yes.
Okay, I'm just going to step over here for the next one.
Yes. Yes. Yes.
Okay, perfect. Next, I will be checking the ocular as well as the ocular motor, the trochlear, and the abducens. So what I'm going to do is just shine this light.
Okay.
You'll look straight and then just keep still. Okay, so what I was looking for was the dilation in her pupils, which is intact, and also the fact that she has a similar shape in both eyes. Okay, so next we will be doing the abducens with the eye movement. So what you're going to do is look straight, keep your head still, and I'm going to move the pen back and forth and just follow it with your eyes only. Okay? So we have it in, out, and then down. Okay, and that's perfectly fine. So that concludes the first half of cranial nerves.
So next half, I'm going to be doing cranial nerves number 5 and 7 through 12. So cranial nerve number 5 is the trigeminal, and I'm going to put my fingers on her temporalis and ask her to clench her teeth 3 times. Can you clench her teeth 3 times? Okay, so she has good symmetry on each side. I'm going to also put it on her masseter and ask her to do the same thing before her vagus. 2, 3. Okay, so she bilaterally, it's good. She has good tension, good strength on her masseter as well as her temporalis. I'm also going to ask her, I'm going to put a tongue depressor in her mouth and ask her to bite down on each side. Can you bite down? Okay, bite down. Good strength. Then I'm going to ask you, can you please move your lower jaw from left to right? Okay, so this checks the medially and laterally muscle functioning, and so far it seems to be good. I would do a corneal reflex test where I would put a cotton ball on her cornea and see if she blinks. If not, there is probably something wrong with her trigeminal cranial nerve. Then I'm also going to trickle my fingers down your face from your ophthalmic, maxillary, and mandibular area, and this is going to see if she has sensations for touch. Can you feel that? Mm-hmm. Okay. So she's good for her trigeminal cranial nerve number 5. Next, I'm going to move to cranial nerve number 7, which is the facial, and it's motor and sensory. So can you please smile for me? Can you lift your eyebrows? Can you frown? Close your eyes tightly, and I'm going to try and open them. She has good tension. She's able to move her muscle functions. Her facial features are good. She has good symmetry. I'm also going to do a taste test on her 2/3 anterior part of her tongue. And tell me if you taste it. Taste it? Mm-hmm. Okay, good. Next, we're going to do cranial nerve number 8, which is going to test her vestibular cochlear. And this is going to see if she has any auditory dysfunctioning or hearing loss. So can you please plug one ear? Can you hear that? Mm-hmm. Okay, can you plug the other one? Can you hear that? Mm-hmm. Okay, so there's nothing wrong. If there was, if she says she couldn't hear anything, we would go into further examination and that. Then I'm going to ask you, at some point, I would ask her to walk across the room and see if her balance is off or not. Then I'm going to do cranial nerve number 9, which is the glossopharyngeal, as well as number 10, the vagus nerve. And with this is going to test her salivary glands, her larynx, her pharynx, and her soft palate. So can you please say ah? And I'm looking right now to see her uvula and her soft palate to see if it rises and falls at the same time, if there's good symmetry with that. And then, can you swallow for me? Do you have difficulty swallowing?
No.
Okay, can you say the top word from the top of your head?
Green.
Green. Was that hard to speak?
No.
So she has no trouble swallowing or speaking, which says that her cranial nerve number 9 is working fine. I'm also going to check the cranial nerve number 11, which is a spinal accessory, which is going to check her spinal sternocleidomastoid and her trapezius. So can you please turn your head to the left, turn your head to the right. I'm going to add a little resistance right now. Turn your head to the left, turn your head to the right. Okay, she has good strength on each side. Can you look up, look down, shrug your shoulders. I'm going to check for resistance, shrug your shoulders again. Okay, she has good strength. There's good symmetry on each side. Okay, and then I'm gonna check her cranial nerve number 12, which is the hypoglossal. And I'm gonna ask you, can you please stick out your tongue straight? There's no deviations. She's not going left or right, which means that her cranial nerve hypoglossal is working fine. And that concludes the end of our basic cranial nerve exam. Hope you enjoy. Bye-bye.
Thank you.